Hi, my name is Vinit Singh. I'm a fourth year student in Group 20. And so today we'll discuss a case of a 5-month-old infant presenting with Epiphora, diagnosed with congenital glaucoma. We'll cover the clinical presentation, examination findings, differential diagnosis, and management.
We're talking about the patient, a 5-month-old baby, which presents to the hospital. On physical examination, the baby presents with constant tearing and photosensitivity of the eye. We see the typical triad of glaucoma in children, which is blepharospasm, constant tearing, which is Epiphora, and this light sensitivity, which is photosensitivity. So this triad we see in the clinical presentation of a 5-month-old child.
Okay, so this is the child that was presented to the hospital. We see the excessive tearing, which is Epiphora, and we see the increased size of the eyes. It's larger than normal. These are the two signs that we saw in the child.
Okay, so I'll be talking about the examination findings of Epiphora in a 5-month-old infant. Here we can see ophthalmos, which is enlargement of the eye, and along with that there's some edema also. In the following image we can see that there's this unique feature, this HAP striae, which are horizontal breaks in the descemet membrane appearing as curved linear lines across the cornea. We can also measure the corneal diameter and find that it's more than 12 millimeters, which again is abnormal for this age. Again, the intraocular pressure will be elevated, and that's confirmed via tonometry under anesthesia.
So my job is now to talk about differential diagnosis. So you see this patient here. This patient has a nasolacrimal duct obstruction. Is a common cause of tearing in infants, and it typically lacks the corneal changes and eye enlargement seen here. So you can see here. And another consideration that we need to make is conjunctivitis or keratitis. So this patient has conjunctivitis, and these would present with a redness and discharge. And the combination of symptoms and examination findings strongly point to congenital glaucoma.
Okay. So we're going to talk about the diagnosis and the management in this case. First, the differential diagnosis is made, and then we move on to the management. The diagnosis is confirmed through examination under anesthesia. First, you assess the intraocular pressure, you check for the corneal diameter, and then the optic nerve status. The initial management includes medications which can lower the intraocular pressure temporarily. The definitive treatment is surgical. It includes procedures like goniotomy and trabeculotomy. Both of them they improve the aqueous outflow of the lacrimal duct. Early intervention is very crucial in preventing the optic nerve damage and to preserve the vision.
Okay, in conclusion, this congenital disorder is quite rare, but it should be treated properly and recognized early. The triad of symptoms include Epiphora, the photophobia, and also the blepharospasm, which is this twitching of the eye. And along with it, you can also have the ophthalmos, which is again this enlarged eye. So thank you for listening to our presentation. I hope it was informative.